Call the meeting to order. City Clerk, you want to take a roll? Hello.
I'm here. City Council Member, Agency Director, Authority Member Doris.
Present.
Molly.
I am present.
Mann.
Ken Mann is present.
Vice Mayor Chris.
Present.
Mayor Pears.
Here. I want to go directly to new bit. Thank you. Let's go directly to new business item 1. Everybody's read the ordinance. I do want to add a sunset clause to it. You know, this until the governor announces that it's no longer a state of emergency in the state, the ordinance should stay in effect. Is the city attorney on?
Yes, I am, Mr. Mayor.
Okay, you can make that correction.
Yes, so then I would add to the section 2, chapter 9.56 is hereby added to the Lancaster Municipal Code to read as set forth in Exhibit A, attached here to and incorporated herein by reference, and will be automatically repealed and of no further force and effect upon the governor of the state of California announcing that a state of emergency is no longer in effect.
Good, thank you. Is there a motion?
So moved. Marvin Chris.
I second that. Okay. Is there any discussion?
Yes, I received one email from, I'm sorry, were you on the discussion part? But I did receive one email regarding MB1.
Yes.
Do you want that
Let's
read?
read it. Yeah, just read it to us.
Okay. This email came from Wes Kelly, and he stated, "We have tried to purchase face masks for our drivers that are out servicing the general public. We ran out at the beginning of this pandemic, are in need of more. Please contact us with a vendor that could overnight these masks so that our drivers can remain compliant to this ordinance." That was the only email comment that I received for MB1.
Mayor Paris,
Yes.
This is Ken Mann. Could you clarify? I think you did a pretty good job on what was uploaded to social media, but could you just clarify? Because I think there was, you and I think there was some misunderstanding about what type of covering is being either required or expected.
Okay, yeah, I will do that. We want everybody to keep in mind that you just have to cover your nose and your mouth when you are outside, when you're going to be around people. This is not to protect you. This is to protect everybody else if, in fact, you have the virus and don't necessarily know you have it. The research coming back is that countries that require a mask are faring much better than no reason to delay. We do recognize that it's very hard to get masks right now, and you're going to have to fashion your own. But it's a great time to be creative. I mean, let's face it, we're having to stay home anyway.
But this is Marvin Christ. Mr. Mayor, we're not requiring masks.
Right, I'm not finished.
Okay.
That's right. We're not requiring masks. You can take a scarf. You can take a bandana. You can take a Marvin. You told me that you use a tube sock. Yes.
Hi. I'm a resident of Lancaster. I'm not on the board, but I did email in a comment about this. And what are the consequences for residents who choose not to wear masks?
Excuse me.
Yes.
Excuse me. We will have time for public comment. This is a meeting. It's not open to everybody. All right? I will get back to you. Did we open the call to everybody?
To clarify, Mr. Mayor, this is a public meeting, but public comment is to be provided through the city clerk as noticed on the agenda. I'm not sure how the individual who was just speaking was able to get on a live mic on this line.
From the city clerk.
Okay, but you're not doing anything wrong. I'm just trying to. We gotta maintain a meeting, even though we can't see each other. I mean, it's difficult for us. But in answer
Understood.
to your question,
it sounded like discussion.
Okay, no, I get that. In answer to your question, yes, we understand it's very hard to get masks. We got 5,000 arriving today that we're giving to the hospital. We got another 5,000 we're giving to the first responders. And that's just a drop in the bucket of what we're going to need. We will have another 25,000 early next week. And apparently there are masks becoming available on Amazon.
That was not my question.
What was your question?
My question is, what are the
Tell me
consequences
what your question
if
is,
we
and
choose?
then please get off the line.
Okay.
All right?
This is a public meeting. Okay. My question is, what are the consequences if we choose to not cover up?
Well, I'm hoping that I don't have to put a consequence onto the ordinance, but make no mistake, that's exactly what we will do. And we will start issuing tickets for misdemeanors if it comes down to that. We are not going to allow anybody in our city to endanger the lives of our hardworking families. And anyone who is not wearing a mask, that is precisely what they're doing. Now, there's no way to be nice about this or kind about this. The law in Lancaster is that you must cover your mouth and nose when you are out in public. That's
you can't
what the
force
law
vaccinations.
is.
How can you force somebody to cover up?
Clerk, I want her cut off out of this meeting now. Has that been done?
I actually cannot control the line from this end, but I will send it to the proper person. Thank you.
The way the ordinance is written now, there is no consequence if you violate it. But that can change in 24 hours. And it will change in 24 hours if people disregard it. We are not doing this because we want to or because we enjoy doing it. We are doing this because people's lives are in danger. We have already lost one person in the city. I don't want to lose hundreds of people in the city. This is not an exercise in civil rights. This is a life and death issue that we have to pay attention to, or we could very easily be putting bodies in cold storage, which is something we're trying to avoid.
Mayor, this is Ken Mann. May I say something, if I may?
Yes, of course.
So from my education, because obviously being in the food service, I get probably, if not daily briefings, sometimes twice a day. But I do understand even the CDC recommends the use of cloth face masks. And they too have acknowledged the fact that their intention in trying to reduce the spread of COVID-19, they're not necessarily recommending taking face masks away from first responders. But again, their recommendations is that everybody use cloth face mask in public. And then it's also been brought to my attention today that San Diego is also requiring the same thing in public. So my sense is this is going to become just good best practices.
Thank you.
Mr. Mayor, this is Marvin Christ.
Yes.
I believe the easiest thing for us to do, especially prior to an election, is to do nothing. We're choosing not to do that. We're choosing to protect the public, to educate the public, to educate them on what is being said by the medical officials. That's what they're telling us that we need to do. That's what we're telling our citizens that they need to do. We're trying to educate everybody and not have to enforce it. I was out at the grocery store today. 9 out of 10 people had their mask on. It is, to me, it is no difference than the signs outside most of those establishments saying no shoes, no shirt, no service. And it's no different than that. And these establishments should not be serving people without face coverings. It's to protect everybody in the city of Lancaster. Thank you.
Daryl Doris, chiming in. I did go to one of the grocery stores, and I don't want to name them if it was something that they're just now finding out. But one of the workers did tell me that when the mask, when the governor came down and said that he would like us to start wearing masks, and then it started going to different cities, that one of the stores that I was in up here, the management had told them not to wear it. So my question is, if we make this ordinance, will our city manager talk to the managers of the grocery stores to make sure that they are letting the management of the stores know? Because I believe some of the management didn't like the look of their workers wearing masks because it was perceived as if the worker was sick. So can we get that clarity out to most of the stores also, that we're not trying to make people seem like they're sick because they're serving in the public? That was a concern that I had heard from one of the workers of a major grocery store up here. And this was just yesterday.
Mayor Perez, Raj Mali.
Yes. Well, first of all, Daryl, Jason, could you have the EOC get some procedure in place to make certain that we contact the larger stores? The other thing is that I'd like the city attorney to prepare an amendment to this, that we can have an emergency meeting to put teeth into it if we have to. I would like to do it without having the hammer attached to it. But I want to make it very clear, we will shut off power to stores if we have to, if they do not comply with this. This is not something we're playing with. It is not something you can thumb your nose at. People are dying in our county. I do not want them dying in Lancaster, and neither does the council. I'm sorry, Raj, go ahead.
No, you took care of it. I was going to suggest something, but you already well said it, so I'm good. Thank you.
Thank you.
Yeah. Now, two things, Mayor. This is Jason.
Nobody hates. Okay.
Yeah, we have a great contact through the EOC with all the grocery stores, and we have a communications team that's ready to send out all the necessary information to make sure that we educate the public appropriately, because we do have a lot of questions and concerns about how to comply. But we are prepared to do that once this ordinance is approved and communicate with all necessary businesses.
You know, I get nobody wants to do it. I don't want to do it. City staff doesn't want to do it. Nobody wants to do what we're having to do. You know, sometimes that's just the way life is. We've got to play the cards we're dealt. Right now, we are dealt some really lousy cards. Let's make the best of it. And that's what we're attempting. Is there any other public comment?
No, I do not have any other comments.
Okay, let's vote. Go ahead. You call the roll.
City Council Member Doris?
Yes.
Molly?
Yes.
Mann?
Yes.
Vice Mayor Chris?
Yes.
Mayor Perez?
Yes. It passes unanimously. Let's hope we don't have to put any teeth to it and that people will just do what's necessary to protect their community.
Rex, I'm sorry, this is Daryl Doris again. Could you please finish your comment about, you didn't really get a chance to finish, or what type of coverings are acceptable? Because, again, everybody's thinking masks. Could you finish that comment? You kind of got interrupted.
Yeah, I mean, I recognize we're going to have to make homemade masks. and quite frankly, I don't care if people have to put their underwear over their head. We're going to have our mouth and nose covered when we're out in public because it will save people's lives. It's really that simple. To me, this is just such a no-brainer. I'm really surprised that we're getting these people that are in rebellion over us asking them to do something that will save people's lives. And I think I've said enough about that. We're doing everything we can to get masks to the first responders and healthcare providers. Those are our first priority. And, quite frankly, it's not that hard to make a mask. Just make it. Cover your mouth and nose. Just do it. I know you don't want to do it. Do it anyway. Okay, we good?
Good. I'm good.
The only other item, Mr. Mayor, is we do have to provide the opportunity for public comment. Generally, I don't know if we received any.
Have we?
No, we did not receive any public comments.
Okay. They can slam me on social media. They don't have to call in, right? The polling of this is the vast majority of people want this for obvious reasons. The vast majority of people understand just this is not a good time for anybody in the country, but we will get through it. On the good news front, Rhonda and the EOC team have been working together with NASA and Virgin Galactic and the college and the hospital, and there are great things coming off the assembly line. It's truly amazing. The one thing they've created is Rhonda, are you on the line?
Answer.
Okay, describe this thing they're using when they intubate people at the hospital.
So basically at this point, there's hospitals that are starting to produce what's essentially a plexiglass box to protect the provider when they have to intubate someone. So those are not available anywhere else, and it's kind of something they've come up with very quickly. So we put all these brains together that were actually working on some other things for us, and they put together what's called an intubation box. And it's basically a three-sided box that goes over the head of the patient that then the provider can look through when they're intubating the patient. And we had a lot of engineers involved, so I think it's probably overbuilt, but that's great because some of them are failing in other areas, and these are not going to. They are built to withstand a lot of abuse, and they're anticipating they're going to need them. The first prototype went on the floor today at the hospital, and they're very excited about it so far.
I'm just thrilled with what we're able to do as a city when we're all working together on this stuff. They've also got three other things that they're producing prototypes on that are going to save people's lives. And it's, Rhonda, you're doing a great job keeping everybody on the same page and moving in the same direction. Thank you.
Thank you.
Perez?
Yes.
I wanted to just share with everybody. I was talking to many of the local doctors, and they are so grateful with our city and staff and our leadership with you that they're saying that none of the other cities are doing that well. The way our staff and everybody is so supportive, and that's the reason we are doing better, and then our numbers are low. And just wanted to thank you, the staff, and you and everybody for the great leadership. Thank you.
Thank you, Roger. Part of that leadership. Look, we got one goal. We've got one goal, and that is to keep as many people alive as possible. If we just stay focused on that and not care about who's criticizing us, we're going to be okay. But we're going to take a lot of heat in the next couple of weeks. And I wish it wasn't during an election, but it is. We play the cards that are dealt.
But people have to understand that the numbers are low because of that.
Yeah, I agree it's working, but trust me, Raj, the people that criticize will criticize regardless.
Yeah. Well, it is what it is.
I've been doing this for 12 years. Would you agree, Marvin, that that's what we're facing?
I would agree 100%. But I think that if Jason could give us and the community that's out there listening a rundown of, making mobile hospitals, getting the testing kits, the masks coming in, everything that staff is doing, if he could give us a quick rundown, they would be quite impressed with what the city of Lancaster is doing and why we're trying to stay ahead of all this.
Yeah, would you do that, Jason? I know we should have given you some warning on this, but
Mayor Paris, again, I think you did a pretty good job. Again, the ultimate goal is what you've already expressed. It's not nobody's trying to hassle people or burden people. We're just trying to keep everybody safe. And then the unfortunate part is so we take those measures to make sure that happens. And I know that, again, there's going to be people that just don't respect that. And I think Raj has already expressed that. We've got low numbers. And like you said, the goal is not to lose anybody. And you know what? To me, I think that is probably the most important goal with the direction that we set for the city is to accomplish that. And it's frustrating when people don't understand that.
Yeah. I just got a text from Stella Lee at BYD. They have delivered their 5,000 masks to the hospital as we're talking. And that's what is that, the N95? That's pretty huge.
Those are good ones.
Because that was a problem. Yeah, that was a problem. Okay. Jason, are you ready?
Yes. Great. Thank you, guys. Just to give you kind of a heads up on what we've been doing, and I'm sure I've missed some of these things, but we're pretty proud of our effort and the work the city's been doing, not only city staff, but the community itself, from volunteers to, you mentioned already what some of our businesses are doing. But just to run down some numbers, on the food boxes, so we've got two feeding programs that we're operating. One is the food box program, which is delivery of boxes of food. We've delivered 2,086 boxes of food, 22,000 pounds of food. The hot meals, we've delivered 2,006 hot meals to residents, and Monday we're going to start delivering additional 50 to the homeless. So that's a total of that's a ton of, literally tons of food that's being delivered. The fairgrounds is close to being operational or ready to be operational. We've got a total of 400 beds set up currently, and 400 more as we expand. The task is monumental, and it's one thing to set up cots and get electrical to each of those sites and prepare for security. But what the hospital has been doing has been phenomenal as well, from not only getting oxygen but pulse ox meters to the pharmacy to staffing. So there's so much that's going on there that is prepared. And again, as you've mentioned, we hope we don't have to use it, but we're prepared if we do. And that has been an effort from businesses from Virgin Galactic to NASA to go down the list of the people we've been working with to put that together. It's a phenomenal effort. In addition, we have 400 blankets there and 800 personal kits for those people that end up in that facility. And then we've also had an additional 400 blankets donated for that facility. So from a perspective of what's happening out there, it's pretty phenomenal. We have 100 gallons of hand sanitizers ready for that facility, as well as other city facilities and public spaces where we have hand sanitizers, so that we can reload those. We've ordered 50,000 masks, 25,000 surgical masks, 25,000 N95 masks that plan to be delivered next week. Included in that order is a 25,000 test kits to begin our test facility that we're partnering with Avors on, and that is hopefully rolling out if deliveries all come through in the manner in which we believe they are, hopefully late next week, so we can test 25,000 residents for the coronavirus. The High Desert Medical Group is already running their current site. They've had 4 days or 3 days of operation. They're running about 90 people a day through that test facility, and there are ways to sign up for that if you need to. We've ordered, in partnership with the City of Palmdale as well as Virgin Galactic, ordered 10,000 surgical gowns or surgical suits for our medical personnel, but not only in Palmdale but in Lancaster. Our Small Business Resource Center has been set up, where we have 5 city staff that are quickly becoming experts on the stimulus package and how do we get our businesses those funds that the federal government has identified. So we hope that this is a call-in center. This is a resource for people who are trying to traverse that to get their money and keep their businesses open. We have 6 small businesses that have applied for the loans that you approved a week ago. 2 of those have been fully funded already. So we're looking for more opportunities there for those folks who want to come in and need some assistance in keeping their businesses open. And then we have 100 or 200 gallons of disinfectant that we plan on deploying Tuesday. That disinfectant is going to be sprayed on our facilities, bus stops, public benches, those areas. And from a social media perspective and actually communicating to the public, because much of this effort is just communicating the right message to people, not only about social distancing, but how to, the hygiene, and now coordinating as it relates to face covering. We've had 260,000 individual connections with people through our media sources, and 150,000 have engaged and spreaded the word. So they've actually either liked, forwarded, shared one of those posts. And I think that's important in getting the communication out. Is we need the community to continue to share those posts so they can see what's the right thing to do, what's happening, and where it's going in that. Because this communication effort from a public perspective is huge. I'm sure I'm missing a lot of things that we're doing out there, but again, and I've said it to our staff and and the people that have been helping us. We are committed to the mission that you guys have set out and lowering it, having the fewest people possible impacted by this disease. And, we're working daily to do that, weekends. I've been on the phone calls with you guys late at night. I understand what's going on. We have great connections with the hospital, the fairgrounds, the AVTA, the Palmdale, the county. Everybody we've been working with is, really focused on this mission. And, it's leadership that matters. And this is the time when we need leadership most. So our staff is continuing, and we're ready and prepared for whatever comes next.
Thank you, Jason. I'm astonished. I mean, I'm really happy with how well everybody performed. I'm not astonished. I really didn't expect anything less. You guys have lived up to your reputations. There's some issues that, I've got you guys on the phone that we've got to start thinking about.
Mr. Mayor, we are not agendized for anything beyond what's on the agenda, and as this is a special meeting, we need to be cautious here under the Brown Act.
The Brown Act has been suspended. I understand your concern. Jason, in regards to the testing that is currently being done at High Desert Medical Group, is that the same testing, that the antibody test, or is it something else that we determined?
It is not an antibody test. I'm not exactly sure what test it is. I know that, again, they've been testing 90 per day, and that is in partnership with the county and the Department of Public Health. The test we were doing, just to clarify, the test we were doing is a different type of test. It's an antibody test. And again, with AVORs, we're working with their doctor and our doctors to determine the best format to implement that. And we're hoping to roll that out early next week as it relates to who's going to be tested and why. But it's going to follow the very similar protocols. Those that are experiencing the symptoms will be able to come and test, but it's a different type of test.
I told you guys at the beginning of this, we're going to disclose everything to the citizens. We're not holding anything back. And a concern we're going to have to deal with next week is, do we make these tests available to people who are not Lancaster residents? I don't know the answer to that, but I want you guys to start thinking about it, because we're going to have a special meeting next week and vote on that. These are the types of decisions we have to make. They're not easy decisions, but I'm interested in getting other feedback from it. And is there any way, Jason, to coordinate with the county to find out if maybe we should be ordering more tests?
Yes, I think with regard to the tests, there's limitations on tests. We are coordinating with the county to acquire more tests. I know in the industry, in communicating with Kaiser, which is one of the largest healthcare providers, and the hospital, they seem to have a very good testing protocol set up, either now or plan to have it set up. So from a testing perspective, those who enter the hospital and those who are Kaiser members, I don't want to say rest assured, but the feedback we're getting from both those institutions are that they have appropriate testing protocols to make sure their patients are taken care of. So from that point, we continue to coordinate with the county to make sure more testing is available. The 25,000 test kits we have, I think from the standpoint of the amount of infection we've been seeing and the time it takes to deliver these, 25,000 tests is going to be a major undertaking. We'll have some time, if necessary, the tests become available. And of course, on a national level, you hear testing, and they're pushing out testing as much as possible as well. So I think I don't believe that is a week from now or 2 weeks from now that'll be as big of an issue as it is today.
Okay, good. Thank you. Okay, I will let the city attorney relax now.
Thank you.
And we will end the meeting. Does the council have anything they want to add?
Marvin Christ, I would just like to thank staff for what they're doing. Hey, Jason, I know you mentioned a lot from the hospital to the fairgrounds to AVTA. I think all the staff and the board of directors on all those other agencies which we're working with closely have to be thanked. You guys have done a tremendous job, so thank you.
This really is a situation where there's heroes everywhere you turn. Yeah, I mean, it's truly remarkable what everybody's doing. I mean, like that device to intubate people that the hospital is using. That was done in NASA people's garage, wasn't it, Rhonda?
Correct.
I mean, it's just fabulous what's happening. Okay, you guys, the meeting is now adjourned. We will have our next meeting whenever we're supposed to. Fair enough?
All right. Good night, everyone.